Hi, I'm Dr. Vince Melanzi. Welcome to another video. I'm the author of a book called Health Recklessly Abandoned, and I want to do a series of videos more or less following the book. So we started with an introduction. I want to go a little bit more into that because unfortunately I think Americans become, let's say, more controlled, not in a good way. We've got a media that feeds us information, that it's bits and pieces, it's very, very short. Not a lot of people really read into research and find out how the research was done and the conclusions of what's really going on. There's a lot of things that you're not told. There's a lot of things behind the scenes. And for example, many people have this idea that healthcare is a necessary, basically a necessity of life. And I'm not saying healthcare is bad. And I'm glad that we have practitioners that can help us out. If we have trauma, of course, it's nice to have somebody who can help us to recover, do surgery, do fantastic things as far as emergency medicine. But when it comes to chronic disease, we've really been told that the only answer is medication. In fact, we've got a culture, and it isn't just this country, it's around the world. We basically have people who do things that are not so conducive to health, kind of ignoring their activity, what they eat and everything, and they're not told anything that might help them prevent problems or improve, or maybe they're just told little snippets here and there. But basically, we wait and see. If your sugar is getting high, we wait and see, because we're not going to do anything until you're diabetic. If your cholesterol's high, we're going to give you a drug to bring it down. We're not going to really look at what the real picture is. It's this idea that you need to be medically managed, that we need managed care, not in the way of managing the patients, because it's not true. What we need is an awareness and a responsibility. And I don't mean that in a way of accusing anybody. People just don't understand anymore that we can really prevent disease. Because for such a long time it was believed that, well, if it's in your genetics, it's going to happen, you can do nothing about it, and we'll have sympathy for you and that's it. But you understanding the mechanisms of how diseases come about, you can do something to prevent them. So that's what the book's about. It's about designing a lifestyle that literally prevents disease. Most of the diseases people contend with don't even have to start. It takes some work though. It takes being physically active. It takes eating real food. It takes watching the things that you're exposed to. But it's not an impossible feat. Again, drugs aren't all bad. Things happen. People need help. That's fine. But that doesn't mean you should spend a lifetime dependent on the drugs. So there's another way. And it's about being healthy for your entire lifespan. Not just, well, I'll be healthy while I'm a teenager and then I'll just let myself go. The degenerative process doesn't have to go as quickly as some people let it happen. The body can regenerate. That's the great thing about being a human being or an animal. You can regenerate tissues. You can regenerate systems. You can get function back if you lose it. The ultimate goal is to not even lose the function in the first place. So it's nice that we have hospitals. It's nice that we have people to help us out if there is an emergency, whether it's a chronic disease or a trauma or whatever. However, if you're dealing with chronic disease, it's really your responsibility to find some answers. Doctors are teachers, they're advisors. They should not be your total management. A doctor is somebody who can give you some clues as to what to do, hopefully, and not just wait for you to be on a drug. That's the problem, is that most doctors don't have much more as far as tools other than their drugs and perhaps surgery. It's all about procedures, it's all about treatments. The true definition of prevention is not letting it happen. And that would mean that you never get the disease and never have that thing to be managed. So we're going to talk more in these videos about real food. We're going to talk about different things. I'll look to talk to you again. Is it security? You just checking? Yeah. Yeah, fine, thanks.